Good morning, ladies and gentlemen, and my dear colleagues. My name is Dr. Eda Gorbis, and I'm a founder and executive director of Westwood Institute for Anxiety Disorders. We treat obsessive compulsive disorder and all other related disorders, as well as all anxiety disorders. I am also an assistant clinical professor of USC Keck School of Medicine, Division of Psychiatry and Biobehavioral Sciences. Today, presentation will be about getting the root of the problem of skin picking and authentic procedures. So therefore, we're going to go on for about 15 minutes right now. So table of contents presented here is going to talk about what it is, what triggers it, and what it is not, as well as how do we deal with it. So what is SPD, definition and the syndrome? So definition of SPD is when excoriation occurs more than 1 hour a day and significantly interferes with functioning. Triggers are usually anxiety, depression, and camouflaging. In other words, putting everything possible on the face so that people wouldn't be able to see the blemishes. People are doing professional cosmetic surgeries and procedures on an ongoing basis and are never satisfied. And then how to screen for these disorders, especially for dermatologists and cosmetic people. Whether or not it is transient or chronic, and then how do we deal with getting this disorder under control. Stay tuned for the following. What is skin picking disorder? It's excoriation disorder, which is a chronic mental illness classified under obsessive compulsive and related disorders in DSM-5. Symptoms include recurrent skin picking, skin scratching, skin rubbing, skin digging, and urges that last for extended period of time for one hour and more, and include dissociative symptoms such as loss of time and not remembering how time has gone by. This is the way one of our patients has looked a couple of years ago. Her face and the entire body looked just like a hamburger, like raw meat. It was covered with scars, blood, and significantly deep wounds. And she used to do it all day long as well as nights. Behaviors results in skin lesions, and symptoms interfere with everyday functioning. As you can see, our patient could not go out, could not date, could not even work anywhere because she was not employable, although she was an extremely successful and brilliant girl. Repeated attempts to decrease stop picking are very unsuccessful. Most common areas are hands or body, face, neck, arms, back of the back, anywhere that the fingers and nails can reach. SPD continues most of the time. Skin picking is done in private and presence of close family. Skin picking results in perceived flaw that is invisible or visible to others. It could be a bump, and it could be something that is completely irrelevant. And comments from others can induce picking behaviors that are negative. Picking behaviors is amounted to approximately 1.4 Americans, and which is equal to 5 million Americans. Primarily starts with adolescent girls and goes on into the adulthood. Prepubescent time is the time when it begins to bother people, and the triggers are visual and tactile, healthy skin, minor skin irregularities, as well as bumps on the smooth skin. They're usually visual, as I said, and tactile, unless it is glossy and smooth and skin and silk-like. They would perceive it as something that needs to be corrected. Lesions, pimples, calluses, scabs, and touching anomalies in skin would perseverate and exacerbate their condition. Emotional triggers are anxiety, boredom, insecurity. However, I would actually change anxiety, that is not so much anxiety, but the trigger would be tremendous amount of tension. And it's the tension alleviation that they are seeking. Also, it is not necessarily negatively but positively reinforced, since it is related to pleasure activities, and it is also considered to be a um, ego syntonic. Syntonic, which means loss of control. Socially commentary provide judgment from others they cannot really tolerate regarding their appearance, and that's what is another trigger. Functional peaking to release tension. I indicated before, and anxiety also. It's usually done through the functional analysis when they're about to leave the home in the morning and sit in front of mirrors, start making like makeup. Some of them go up to 8 hours doing the makeup, but then they see or feel something, that any anomaly would uh, would onset the skin picking behaviors, and then they dissociate and lose time. And then when they kind of wake up, they may be already bleeding, and their faces would be completely unpresentable to self and others. It consistently implies also impulsive behaviors, and it is also an avoidance behaviors, because as I indicated before, they may be avoiding an interview, avoiding the place of work, or avoiding any dates. Possibly it is all together. Avoidance is related to the anxiety and related to heightened tension of criticism. Individuals may not be aware of the behaviors until they are bleeding. 1.4 Americans around the world, it's all the same, primarily females. But please note to yourself that females are afflicted by mental disorders 3 times more than men. It is related to the hormonal changes in women's lifespan. Women are changing hormones prepubescently, post-prepubescently, before they get impregnated, during the pregnancy, postpartumly, and then also before menopause, during the menopause, and post-menopause, whereas men have significantly less changes of hormones, and hormones regulate entirely um, the entire body. It is very, very important. When they are off, then the entire body is completely off. Chronic condition, yes, it is. It is chronic, and it becomes chronic when loss of tissue becomes there, scarring, infection, extreme cases. It does become life-threatening and irreparable. Time lost from peaking throughout the day, difficulty concentrating at work, loss of work, poor management, and responsibility. They are unable to also structure their days, and it seems that it's the frontal lobe that is involved in the organizational skills that is afflicted in cases of impulsivity. However, the comorbid disorders also include OCD, include BDD, and may include social phobia and significant depression. A chronic condition, they lose control, have shame, embarrassment. I already talked about it before the slide came in, but we'll repeat again: OCD, social anxiety, depression, and definitely body dysmorphic disorder, difficult to treat and succeed with. SSRIs, EXRP, and also what is the most important is competing behaviors, doing the different things. Knotting and, like sewing may be important also to do to keep the hands constantly busy. For authentic practitioners, because they seek them, and they seek dermatologists, and they seek the nurses and cosmeticians instead of psychiatric services. Patients assume it's bad habit, but it's not bad habit. They need to be realized and understand the seriousness of condition. They want to remove the imperfection and harm themselves in the process. They're never satisfied. They seek and find other blemishes in the same place or other places and continue repeatedly to do the surgical or non-surgical interventions. And there is a way. They also know that people who do procedures, that they may have deep pockets, and they continuously sue them. In this lecture, I have developed and designed certain questionnaires where you could possibly screen whether or not they are the repeated patients. Most people seek out dermatologists and cosmetologists instead of psychiatric patients. Patients assume that it's bad habit and want to remove imperfections, and they harm themselves. It was many times in my life that, at least four, that when I confiscated certain instruments from patients so that they don't use them, such as tools to cut, to twist, to remove self-cutting. Individuals are considerably trying to fix their skin through repetitive facial procedures, but it does not bring them any satisfaction or any improvement, because they will ruin the skin again and again and again, looking into the mirror, until this issue of the excoriation disorder is addressed, until they get through EXRP and through blocking the mirrors, through abstaining from giving in to the peaking, it will not be addressed and helped. Screening for SPD: how many dermatologists you saw, how long you've been doing these procedures, and how much you got the improvement. And then please read these specific questionnaires. What are you doing at the time? What were you, cognitive behavioral therapy? Yes, but I am a behaviorist, so therefore Habit reversal, I mentioned it before, acceptance that yes, this is my illness, it's chronic illness, I will always have it, and I need to keep my hands away from my face. So therefore, maybe putting some coverages on your nails, and so that to prevent yourself from any of the scratching. Treatment may include more than one modality. And now I would like to thank you for your attention, for your concentration, and for your desire to learn this difficult and complicated impulsive disorder called excoriation disorder of skin picking. Many, many thanks to you. You were listening to Dr. Eda Gorbis.